Hey everyone, it's Dr. Alicia here, and welcome to the She Found Motherhood podcast. Today we are talking to Jay Duncan, who is an amazing doula here in Victoria, BC. She works with both Vita Doulas and the Nesting Doula Collective. We talk about all things labor, delivery, and postpartum support, and how incredibly important it is to go into your childbirth experience empowered with knowledge. We talk about childbirth education. She's got some great in-person education classes, and She Found Health has some great online education classes. So important. So we'll get into that conversation right after this.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Hello, Jay, and thank you for joining me today. I'm so excited to chat with you.
I'm very excited to chat with you.
Yay. So why don't we start by, Jay, just tell us a little bit about yourself.
Sure. Obviously, name is Jay Duncan. I'm a mother of 2, a 22 and a 23-year-old. I have lived in Victoria for probably we're going on 20 years now. Live in the Fairfield area. Live with my husband. We've been together for 25 years. I just love Victoria. We love outdoors. We love kayaking. We love skiing, all the good stuff that Victoria has to offer. And I'm a birth junkie. I absolutely love birth. Since I was about 11 years old. I just loved it. And it wasn't until I had my 2 children that I started kind of, looking at birth work as a career choice for myself. And so that was probably around 1998. They were born in 96 and 98. So it was until my son's birth. Then I decided, let's do this. This looks like a great little career choice. So it's wonderful.
And you are a doula. That's what you're talking about by being a birth junkie, correct?
Absolutely. I'm a birth doula. Yep.
And so you kind of say you're a birth junkie. Was there any one moment that inspired you to become a doula as opposed to some other way of kind of being involved in birth?
Really, it was the birth of my 2 children. I had done a lot of research on midwifery and natural birth, and I was very, very interested in midwifery and as well. And at the time I had my 2 children, I didn't know anything about doulas. So that wasn't even a situation that I even delved into, but it was just, I loved teaching. I loved adult teaching. And so I thought, well, what could I do to match my love of teaching adults and my love for birth? And I just, all of a sudden, I was living in Vancouver and it came to me going, well, why the heck don't you work as a childbirth educator? So that was kind of my introduction to birth work, was working, and I did my training at Douglas College as a childbirth educator, and that's how it all started. And it was my preceptor who said, well, if you'd make a really good childbirth educator if you were a doula. You'd have a little bit more breadth of different types of births. And it wasn't even in my mind. I actually had to ask her, well, what the heck is a birth doula? I didn't even know what it was at that time. So I went on my first birth with her, and that was it. I got the bug. My kids were really quite little then. So I started off as a postpartum doula. So I worked with families after the babies were born, because I could schedule my day a little bit better with small children. And as they got older, basically I'd say about 10, maybe 9 or 10 years old, 9 or 10 years old, I started to delve a little bit more into birth doula work.
Because it is a little bit more unpredictable being a birth doula, and the hours are definitely less conducive to being home for bedtimes.
Absolutely, absolutely. And they were just too young at 2 or 3 years old to be left, even my husband was fantastic, but to be left for 24 hours or more, because sometimes those first time births, and those are usually the people who call for you, those first time births can go very, very long. So I just felt very uncomfortable doing that when they were smaller and toddlers.
Fair enough. So for those people who don't know, and I think even though if we have a sense of what a doula is and what role a doula can play in that experience, would you mind telling us a little bit more about what a doula is and what's the role that you see of a doula throughout the pregnancy, postpartum, childbirth experience?
Absolutely. Well, doula is actually an ancient Greek word, and actually I think it's translated as a woman's slave. So it's been known, the role of a doula has generations and generations of people using basically caregivers who looked after women in their, during their birth and after their birth. And so my job, one thing a bit different is between a midwife and a doula, because I always get mistaken for a midwife, is that doulas don't have any obstetrical or diagnostic background or education. So our complete, our duty basically, or our focus is on the emotional and the physical comfort of a person during the birth of their babies. So I offer emotional comfort, I offer physical comfort. For example, learning how to get into different positions to progress the labor. I help them with natural comfort measures as far as helping them deal with the pain of labor and the discomfort of labor. We work as an advocacy role, so helping them find the information that they may need to make the informed choices for themselves. Beautiful thing about doula, when they come to your birth, they offer continuous labor support, which means because we don't work on shifts, we don't leave. We don't leave until the baby is born. So you get that continuous labor support by an individual who's not necessarily a member of the medical team, which is always really quite comforting for a lot of people. We usually meet you at least 2 to 3 months before the birth of your baby, so that we have a really good idea who you are, what kind of birth you would like, and any other kind of issues that may be coming up within your pregnancy. So by the time we get to the birth, we know you quite well. And so there's not a lot of explaining that you have to do with us, because we've known you for at least 2 or 3 months before the birth.
And a lot of pregnant people ask me about, well, my partner's going to be there, so why do I need a doula? But part of what I see a doula's role is, and I think a really important part of what a doula's role, from what I've seen and experienced, is that doulas help partners support the pregnant laboring person more effectively, because a lot of time we have no idea as a partner what to do, right? And so I think tell me a little bit about that.
Most definitely. And I think that that's sometimes a conversation that some couples have, and sometimes it's the partner says, well, I'm here, so why do we need a doula? One thing that the doula can offer is experience, and so experience within birth. And so we know what birth looks like. We've been to a few births ourselves, so we know what normal looks like, and we can actually help the partner normalize the whole process. And so they're not worrying so much about what's going on with their partner. Another thing that we do is we can advocate for him or her, as far as, what kind of questions they need to ask in regards to the health of their partner. A lovely thing that doulas do is that we will come to the house in early labor. So sometimes if you're planning a hospital birth, sometimes you're not ready really to go to the hospital yet in early labor. So what a doula can do is help those partners, actually will help the couple stay at home as long as possible. And then while we're in the home, the partner doesn't have to feel that they have to guess about, oh God, when should we go to the hospital? When should we call our doc? When should we call our midwife? Basically, by having a doula in the home with you, they'll take care of that and they'll help you. And so because we're looking after all those kinds of issues, then the partner is actually free to actually support the partner with not having to worry about all the technical or all the other stuff that go along with a birth. We can also, I think I mentioned, we can also normalize the process, because sometimes as a partner, you may not have seen your partner in pain or on, throwing up or on all fours or moaning. And what we can do is just say, hey, you know what? They're doing absolutely fine. And so that tends to calm and reduce the stress for some partners, and then they can kind of enjoy the process. And and at least be a really supportive partner without having to worry about what's happening.
It's so true. Labor is a very primal thing. And a lot of these days, we don't experience that
Yes.
in any other aspect, really.
Absolutely.
And so it's really hard for many partners to see their pregnant partner who's in
Mhm.
labor and in pain, see that and
Absolutely.
not worry and want to kind of fix it. And
Mhm.
it's the fix is having a cute baby,
Yep. That's it.
and or other options. But certainly it's a really important thing, kind of knowing what to expect going into it,
Yeah.
being well informed, and whether that's through kind of a good childbirth education, which I know you guys do some
Mhm.
great in-person childbirth education classes. We've got one online, but like
Yeah.
that's a really important piece of it.
Huge.
Or having somebody there to support you, to kind of work with you to kind of normalize things. And yeah, this is what we expect. Oh, this is not normal. Now we need to kind of
Right.
call the doctor or go
Mhm.
in or whatever that looks like.
Absolutely. Yeah. So we kind of take the guesswork away from the partner so that they can kind of just be a little bit more present with the labor and not have to worry about, oh my God, what is happening here? And should we be calling the midwife here? And how do we time these contractions? So I find lowers the stress level a little bit. And so now the partner can, like I say, kind of enjoy the process of just taking care of his partner or her partner.
It's awesome.
Mm-hmm.
So you kind of touched on this a little bit more, but what is a typical course of care for a doula? So for people who don't know, doula
Sure.
is private paid.
Yes.
And there are some ways, if you can't afford a doula, to
Absolutely.
access doula services as well.
Mm-hmm.
But for a kind of a typical course, when would people first contact you? What would that look like through pregnancy? What does that look like through labor? And what are the possibilities postpartum? Do you mind running through that?
No problem. So sometimes people, they call a doula as soon as they pee on the stick. As soon as they know that they're pregnant, they're like, oh my God, I want a doula. And then there are some people that come to you at 35, 37, sometimes 38 weeks. And so typically, around that third to fourth month, that's when usually people start calling us. And they can find us anywhere from the Doulas of Victoria website, through obviously my collective, Vita Doulas. I work with another collective called Nesting Doulas, and we are doulas of color who typically serve other individuals or birthers who are of color or Indigenous. And so there's options there if they want that. We usually start off by a meet and greet. So basically, if people go to these sites and they see a couple of doulas that they feel, oh, these guys look great, we usually encourage people to actually interview a couple of doulas, because this is about connection. And it's not necessarily about, oh, well, I only want somebody who has 10 years experience, or I only want somebody who is a mother themselves. It's really about connection, because we're going to be there at the most vulnerable time of your life. And you've got to be okay with us seeing you maybe cry and seeing you moan and maybe seeing you naked or seeing, all that kind of stuff. So it's really about the connection. So the meet and greets are usually non-obligation. We sit down, we talk a little bit about what they would wish for their birth, and we give them an opportunity to ask us questions about our experience, or what got us into this role of a doula. And then, because it's non-obligation, then I usually give them a week or two to decide if they want to go with me or not. When that is decided, then what we do is we set up our prenatal visits. So usually the first visit is probably about a month to a month and a half, for me anyways. Everybody's got kind of different parameters, but for me, it's usually about a month and a half before the due date that we set up a meeting. I usually go to the home. And that's usually when I ask a million questions about who they are and how they want to be supported, and what are their attitudes towards birth, and how do they think they're going to deal with pain, and what do they feel they're going to need from me as far as support is concerned. I ask a lot of questions to the partners. Are you okay with blood, vomit, mucus, all that kind of stuff? Because that happens. And and I want to know, should I get a stool for you if you're going to feel a bit woozy? And and how hands-on do you want to get? I mean, do you want to do the massages? Do you want to do everything? And basically, me as a doula, I will suggest things for you, but I usually kind of stand back and be as hands-off as possible if the partner really, really wants to get involved. And then, of course, there's, depending on what part of the labor, sometimes I take the wheel, sometimes the partner takes the wheel, all that sort of thing. And then we talk a lot about the postpartum plan as well. That's usually around in the second visit. I talk a lot about this, and usually a second visit is about 2 weeks to a week and a half before the due date. And that's when I emphasize postpartum plans. So who's coming to help you guys, suggestions for meal trains, what they should expect from their newborn in the first couple of weeks, all that kind of stuff. Then I'm usually on call as of 38 weeks. And basically my phone is now sitting on my bed table, and I'm basically waiting for them. And I always emphasize, do not text me. If you need me, give me a call, because I don't wake up to text. And because most of the time I'm going to get a call at 2 or 3 in the morning. That tends to be when everything happens. And we go across, and I usually don't fly over to their home as soon as they call me, because I do emphasize that I want them to call me as soon as they even think that they're in labor, just so I can arrange my life and make sure that I'm not on Mount Doug with my dog while they're at, 5 minutes apart. So usually that first phone call is just kind of back and forth. How are you feeling? If it's at night, I may suggest strategies for them to go back to sleep, because what we know about early labor is that what you're doing is you're really prepping the body for the challenges of active labor. So the more rest and relaxation you can do in your early part of the labor is really, really helpful. And I find that's where doulas really, really come in, because I think as new birthers, sometimes you're not quite sure when it is time to call or when it is time to go to the hospital. And what we do find is that sometimes people get to the hospital too soon. And so what we can do as doulas is we can encourage people to stay at home as long as possible, and really get to a really nice, good active labor pattern. And then we can either accompany them to the hospital or call the midwife if they're having a home birth, and all that kind of stuff. So, and then we leave from the hospital. So I either tell my clients, if when it's time to go, I can either come in the car with them if partner is feeling a bit nervous traveling to the hospital with a moaning woman or a moaning birth person, or I just travel right behind. And make sure that when we get to the hospital, I can accompany the birther in a wheelchair if they need it, and then upstairs, and we get them all situated. And because a lot of doulas are familiar with the hospital, we can help, put the bags on the windowsill and make sure that the partner knows where everything is that they need, and all that kind of stuff. And then we just basically kind of rock and roll, whatever was happening at home that was helping. With the birther's comfort level, we repeat that at the hospital. So, what we would be doing at the home is basically offering all that emotional and physical support, and rubbing backs, and putting hot pads on backs, and all that sort of thing. Holding hands, wiping tears, helping them breathe, helping them connect with their breath during the labor. And that's exactly what we're going to be doing at the hospital. It's helping them get through this process as seamless as possible. And we're also going to help them, if obviously the birth doesn't go the way that they planned, we're going to help them and support them with that as well. I think there's a fallacy out there that sometimes I'm planning on having an epidural, or I'm planning on having interventions, so I don't need a doula. And that's so far from the truth, because doulas are not there just to support natural, bird singing, Enya births and sage in the room and all that kind of stuff. And my God, if you want to have a birth like that, I'm going to help you get that. But I'm also going to talk to you a little bit about how varied birth can be, and how flexible it's really, it's really, really helpful to be as flexible and open as possible to all circumstances. And I just want to make sure that as your doula, whatever happens in that birth, I want to hopefully make it as a positive and an empowering situation for you. I usually don't leave until the baby is born. So whether that is a vaginal birth or a cesarean birth, I wait until I can meet your little peanut. And then I usually hang out in the hospital or the home for another couple of hours just to get people settled, help with early breastfeeding, helping the birther to the shower if they need to clean off. If it's a home birth, we'll help make your bed, clean your bathroom, all that kind of stuff. Help feed you, empty out the birth pool, all that kind of lovely stuff. And then I usually offer 2 postpartum visits after the baby is born. The first one usually is about 24 hours after the baby is born. And I like to see people quite soon, because I think it's really cathartic to talk about what had happened, especially when it's really fresh in their mind. And, if they have any questions about the birth process, or they want to ask any questions, or they just want to talk about it, I think it's really cool. Just let's talk about what happened, like how freaking amazing you were. And then we talk about any baby and the baby issues. And then the second visit is usually when they are home. And so if they were in the hospital, and when they're discharged, I usually give them a day or 2 to settle in, and then I come. And I usually like to see them within the first week, because as we know with labor, sometimes there's a bit of a hormonal dip around around the 3rd, 4th day. So I kind of like to get in there and talk to birthers and families about what is normal and really what their postnatal day or weeks should look like. So helping them with sleeping, helping with the baby, wearing the baby, helping them wear the baby, any kind of breastfeeding issues that have come up. We all doulas are trained in basic breastfeeding information. If the scope is too much for us, then we will definitely help them and recommend either to see their doc or their midwife, or help them get a meeting with a lactation consultant or a breastfeeding counselor.
So this is why I love you so much, Jay. I love working with Jay. And I recommend Jay to everybody, for those of you who don't know. And we have her Vita Doulas on our website, but now I'm going to put the collective as well. But the biggest theme that I am getting from you, correct me if I'm wrong, is preparation, letting people know what's normal, letting people know what to expect so they can go into their birth experience informed and aware that it's not necessarily all going to be sunshine, roses, unicorns, and Enya, as you said, right? Like birth comes in all different forms, and we as pregnant people have no idea what it's going to go like for us when we get in there. And so Dr. Sarah and I are huge proponents of this as well. We think it's so important to be prepared going into it, to know the realities that might happen. We can hope they won't happen to us, but it's good to have a good sense of that, right?
Absolutely. Yeah. And sometimes actually in the prenatal visit, we will actually talk about a cesarean plan too, just in case. So if if we did go down that road of a cesarean, what kind of information would you like? What can we do? I know sometimes it's an operation and sometimes there's not a lot of options in there as far as the, skin to skin right away and all that kind of stuff, but we can help to facilitate that and at least get our partners and their families to ask questions, even in the OR, about, well, is it okay if the baby comes to her now? Is it okay if we can unstrap an arm so that she can touch the baby? Is it okay if the partner wants to do skin to skin in the recovery room? All that kind of stuff, which is great. And it just really helps to okay, if it doesn't go down the road that I want to, I still have some choices. Which is really, really important.
Yeah. And that's another thing that Dr. Sarah and I are big on, is our birth plan, or birth preferences, we like to call it. And we've got a free download. We'll link below.
Okay.
But we kind of go over what are your hopes, when would you accept an intervention, whatever that is? Absolutely. What would it take to accept an intervention? Not do you want it or not, but here are the things that could happen, and when might you accept an intervention? So it gets people thinking about what could happen, and so they can start having conversations with themselves, with their partners, with their care providers, with their doula, to get more information that they need. So when they're in that moment, that birthing moment, it's not so overwhelming, because all we want for our patients, our clients, is to have a positive experience, however that goes, and to be able to look back and think fondly of that moment when they first see their baby, because that is the goal, is to have a good experience. It's not going to necessarily be the perfect one, the one you dreamed of, but we want it to be positive, and we want you to remember it as that moment that you first laid eyes on your baby, right?
Well, for sure. And sometimes, a couple of things I want to say is that sometimes when people are getting a little distraught, sometimes if it's going into a cesarean, I always tell them that, a cesarean is still a birth. A birth is the baby coming out of your body. And you're not going into that OR to get your tonsils out. You're going in there to meet your firstborn or your secondborn. And I think that needs to be celebrated instead of, and I know it's very frightening for a lot of people, and I'm not taking that away from anybody, but I really do like to emphasize the fact that you have birthed the child. You have birthed the baby. The baby came out of you. And it's not only about the transition of that baby from inside to out, but it's also about the transition of a couple's becoming parents, and your mother becoming a grandmother, and your sister becoming an auntie. Everybody is birthed in regards to this coming of this beautiful baby. And so I find that needs to be emphasized. I also want to mention too, but because I'm a childbirth educator, a lot of people say, oh, well, I won't do childbirth education because if I choose you as my doula, then that should be enough. That's not how it goes, because it's one thing to support you during the process of birth, but it's another thing to teach you about what's going on with your body and to talk a lot about options. And so it's imperative that I feel that people take a really good childbirth education class first before they go into this birth process, just so they have an idea of the interventions that are available, of options that they have in regards to positions, all that sort of thing. I think it's really, really helpful and very, very powerful to go into the birth process with that knowledge behind them.
And tell us about your childbirth education classes, because I know you guys have a couple of different options. I always suggest the 40-60, the 60-40?
Oh, the 60-40. Yeah, that's that's Vita Doulas. And that was a brainchild of our founder, Laura Warren. And she found that what we should do is offer 60% birth information as well as 40% post-birth information in the same class, instead of people having to take different courses for baby care. And so that formula has really worked really, really well for us. So right now, we are just opening up in-person classes. Due to COVID, our classes are small, so no more than 5 couples per class. And I do teach once a month at the Roundhouse space in View Royal. Just behind the hospital, actually. And those are weekends, Saturday and Sunday, 9 a.m. till 3:30 p.m. on Saturday and 9 a.m. till 4 p.m. on Sunday. And it's a lot of information on that weekend, but I think people really like to get all the information at once. And because of the popularity of that, we have now opened up a Monday night class. It's 2.5 hours, but it's 4 weeks. And that is being held at the Vic West Community Center. And our first class is October the 5th, and still 5 couples. And then there's also people who sometimes can't make a group class. So we either it's because they have scheduling or it's because they're on bed rest. And so we also offer private prenatal classes where we will come into the home and offer private prenatal sessions. And those are usually a little condensed. So they're about 2 to 2.5 hours for over 2 days. So it's either, one a week, one a week and another week, or 2 within the same week. It depends what you want.
And we will make sure we will link all of that info on how to get a hold of you.
Oh, that'd be great.
To access the childbirth classes in our show notes below.
Excellent.
Is there anything else? We've gone through a ton.
Yeah.
You're like me, Jay. We talk quickly.
I talk quick. I'm sorry.
I love it. But is there anything else that you really want pregnant people to know about doulas and the support that they can provide?
I think we didn't really quite touch upon price. All doulas basically are entrepreneurs. We are all self-starters, so we don't work for an organization. Unfortunately, doula fees are not covered under MSP, and we would love to change that, most definitely. So typically, you can find a doula there are volunteer doula programs. In fact, there is an Aboriginal doula program that is free for the birther, and the doulas will be compensated through the organization, the Aboriginal organization. So that's definitely, if you identify as Aboriginal, or even your partner identifies as Aboriginal, you are enabled to access those funds. So that's really a wonderful opportunity. Mothering Touch downtown, Eva Bill does teach and train new doulas, as well as actually nesting doulas. We're going to be doing our first doula training. And those doulas coming out, sometimes they would offer lower prices only because they're brand new and they just want to get the experience. So most definitely there is an opportunity there to obtain a newer doula coming out of these trainings. So they sometimes offer the trainings either free or starting at $100. Typical price for a doula is anywhere from $500 to $1,000. Some doulas will do sliding scale. So whatever your budget can afford, that's what you pay. And I do offer payment plans as well. So if you cannot do the whole, $950 or $1,000 chunk, we can work it out with you so that it's affordable for you and that we respect your budget. I just don't feel that anybody should not have a doula based on economics. We'll make it work. We will make it work.
Awesome.
Mm-hmm.
And then one other thing I know both you and I wanted to chat about is we are currently in the time of COVID.
Mm-hmm.
Our hospital has opened up, but I would like to have a conversation around doulas, and because in some communities that people are listening, their hospital does not allow a second support person. So Is there a role for doulas in the peripartum time and the childbirth kind of time if they can't physically come into the hospital with you?
Absolutely. And I think that was what we were finding, is that some of our doulas were actually, their bookings were actually going down, because I think people felt, well, if the doula can't go to the hospital, then why bother? But as I was talking before, that early labor piece is really important. And in most cases, you would be supported at home. What we find, especially if you're a first-time birther, those early labors can take a long time. And so just by having a doula in the home with you, or even, an ability to connect with that person, and ask them about what is normal, when should we head to the hospital, when should we call our midwife, how should we time these contractions, can you come on over and give us some reassurance, is hugely valuable. Absolutely valuable. And doulas are pretty creative. So there's a lot of doulas who are working even with parents who go to the hospital, who are using FaceTime or Skype or Zoom. And so, a whole, computer is set up in the hospital room. There's been times where, and I always tell my clients too, especially before we were able to come in, is that, when you go to the hospital, I'm not going to bed, because if this were not COVID times, I would be going into the hospital with you. So even while they go in there, I'm still awake, and I'm still kind of, and I emphasize that you guys need to call me or text me or communicate with me if anything that you feel you need support with comes up in the active labor phase while you're at the hospital. So it's not a case where I just say, oh, well, you're in active labor and I'm allowed in the hospital, so see ya. That's not how it goes, because I'm still their doula. And so I would still be available, through all sorts of technological means to offer my support. And of course, there is the postpartum piece of the doula too. So when you end up coming home, I can still, at least, may not be able to visit you in the hospital, but I can certainly come to your home masked up. Obviously, we respect all COVID protocols, and we would do what we need to do to keep everybody safe. But I would still be able to, to support you at home with that baby. And most doulas, they will support, or be on call for at least 6 weeks after that baby is born. So any question, any text, any visit that you may need from your doula, you can still obtain that. So, there's only one little piece that we would not be able to be in the hospital, but that does not overshadow the entire scope of the care that you would be, that a doula could offer you.
And I think a big piece of what you can still offer, even if you can't go into the hospital, is, like you said, you can still go in early labor, and you can help the partner learn how to support you better during that labor when you are in the hospital. So
Absolutely.
You can really work on that groundwork to get those skill sets in home, so they can be then transferred to hospital.
Oh, for sure.
That is so valuable for the partner, if not even for the laboring person.
Oh yeah, absolutely it is. Yeah. And so, that's usually what we're doing in the, obviously before things opened up for us, we, at the home, we would say, okay, when she does this, this is how you're going to do it. It's all that sort of thing. And so really a lot of that communication sometimes comes from the partners, because they're asking, like, okay, she's in the shower now and blah, 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 and this is happening. So what should I do now next, Jay? Okay, well, this is what I would suggest. Why don't you get her on the, on the bed and get her in the knee to chest position and see if we can change that baby. So, there's still communication, and there's still lots of opportunities for you to be supported by your doula, even though they may be restricted to go into the hospital with you.
Okay, I'm going to put you on the hot spot here, Jay. Dr. Sarah and I are trying to compile our favorite resources, those things that we love during pregnancy, delivery, postpartum, newborn care, things that we hear from our patients or our friends, other colleagues, that are just invaluable. Do you have anything through your journeys that you think is a really good thing to have, whatever it is?
What is it a good thing to have? So are you talking about resources like books or?
Books? Some of the things that we have: pregnancy pillows, nursing bras, those water wipes for babies' bums afterwards. We've got a couple of courses, but like a great book, anything. It can be anything.
I love padsicles. I think I love that whole idea of padsicles, especially and padsicles, for anybody who doesn't know, is basically putting a bunch of pads in a freezer, putting a little bit of witch hazel or aloe vera gel on these pads, rolling them up, sticking them in your freezer. And then when you need them, because there's going to be postpartum bleeding, that cold pad on your perineum mixed with the witch hazel and the aloe vera gel really does wonders to help to soothe those perineal muscles. Absolutely. And I I just can't emphasize more is set up a postpartum plan. Who is coming to do what? Hundreds and hundreds of years ago, we would have birth in large communities and villages where all the matriarchs in the village would come to help us, heal and nurture this baby and nurture ourselves. And I find in the Western culture, we don't really respect that time as much. So I think, I think I think that results in sometimes higher levels of postpartum depression and anxiety, to tell you the honest truth. So I find that I don't think we honor the healing and the nurturing of the postpartum birther enough in this community. So I would say and if it's somebody like your mother, your mother-in-law, your father-in-law drives you crazy, then don't get them to come into the home, because we want everybody to be as stress-free as possible. But you do have friends. There are postpartum doulas, which I know that maybe you'll be talking about a little bit later, where these are doulas that are literally just trained to work with you in the home after the birth. And these are people that, they $20 an hour, $30 an hour, and they will come 2-3 times a week just to help you with that baby. That's imperative. I think that's imperative, is set up a good postpartum plan and take care of those perineums of yours. I think that's really what and support. It's all about support. Getting support for breastfeeding is a huge one. I find so many people are having so many struggles with breastfeeding, and I just find, get the support right away and don't let a little problem linger, because I find with breastfeeding issues, a little problem ends up to be a big problem in a couple of days. So really use the resources that you have, your midwife, your doula, your childbirth educator, your lactation consultants, breastfeeding counselors, which we have 2 breastfeeding counselors actually in Vita. Kate Lorimer and Laura Warren are amazing breastfeeding counselors that can really help you get on your way. Because even though your body was made to make milk, and this baby has a real strong sucking reflex, neither of those have met before. So everybody is learning, including your baby. Your baby's learning how to do this itself, and just taking it easy. Taking those 40 days to recuperate and to relax and to nurture yourself and to learn about your baby and not have a lot of other appointments and all that kind of stuff going on. And it's really, I think you did a really nice piece, Alicia, about that. And I just thought, oh yeah, that would have been so nice if I would have known, if I would have been told that, right? Oh my goodness.
Well, that's why we're doing this. Cause we've gone through this, and Dr. Sarah and I are like physicians who literally care for pregnant and postpartum people, and we didn't even know, so much of this stuff we didn't know. Our care providers didn't tell us. We didn't learn in school. We've just learned it on the way. And so this is like the entire point of why we do what we do. But so Dr. Jasmina and I, she's a perinatal psychiatrist who I know you know, we just did a podcast on the top 5 tips to help improve your postpartum. And the 5th one, and most important, is set up your support plan.
Gosh.
Set it up before you have a baby.
Oh, I cannot emphasize that more. Emphasize that more. So there's always people who are good cooks that there's people who are willing to do your gardening or clean your house or take your dog for a walk, or these people in your life now. So set it up.
Exactly. Love it, Jay. Hey, thank you.
Oh my gosh.
Always a pleasure.
So much fun, Alicia. This was great. Okay,
we will link all of your stuff below. And if people want to get a hold of you, how can they get a hold of you on Instagram?
Oh gosh, Instagram. That's all Laura's thing. Oh my gosh, I do have my own tag, Doula J. That's my Instagram tag, so they can always get a hold of me there. My email is mama_jay@hotmail.com. And they certainly can get a hold of me through any of the couple of doula collectives that I belong to, including Vita Doulas, vitadoulas.ca, and the Nesting Doula Collective.ca, if they're interested. So lots of opportunities to get a hold of me.
Amazing. Great. Thanks, Jay.
You're very welcome, Alicia. Thanks so much.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.